We now take you to South Africa, where charities are filling in the gaps in the healthcare system, which has been stretched by the pandemic. At the peak of the third wave in Gauteng province, doctors were having to choose who lived and who died because of a shortage of beds and oxygen. But now, a humanitarian organization has stepped in to provide life-saving machines to people for free. They've also partnered with doctors in one area of Johannesburg to run a night clinic, as Ntshepeng Motema reports from South Africa.
Volunteers at the Rosi Azam Welfare Foundation thoroughly clean every machine before they lend them out again. The charity provides these life-saving oxygen pumps to COVID-19 patients around South Africa at no cost.
When people started sharing their success stories of winning the battle against COVID, that's when our organization really got well known at a national level. And then we started receiving phone calls from Cape Town, started receiving phone calls from Durban.
Through donations, the non-profit organization is able to loan out these oxygen pumps to people with severe breathing problems. Each of these machines costs around $700, much more than most South Africans can afford. Safraz Khan is one of the recipients of the oxygen pumps. Khan recently became a father after trying for 7 years and thought life couldn't get any better. But then he became severely ill with COVID-19 and nearly lost his life. At his lowest, he says it was his wife and newborn baby that gave him strength to hold on.
Certain times where you just sit there and you cry because you can't do it anymore. And without their support, she'll come, she'll show me the child from far. This is what you need to do for. It's really, you have to fight.
As an asthmatic, Khan's doctor thought he was better off receiving treatment at home and was able to connect him to the charity providing free oxygen machines. Even though Khan is one of the 16% of South Africans who have private health insurance, his physician worried that he may not get the treatment he needed, even at private hospitals, facilities which were also being overwhelmed. During the peak of the third wave, patients faced pressures on how long they could be kept on an oxygen machine before the next one had to have it. To alleviate some of the pressures on the healthcare system, a group of doctors has come together to offer a range of medical services to their community. Each day when they finish work, they come here and operate this clinic free of charge, often seeing patients late into the night. Those they are helping are people who are unable to pay for private health care.
So basically, we are doing primary health care, but we see tertiary, we see the medical emergencies, we see COVID patients, we see all sorts of patients.
Knowing the devastation that the pandemic can cause, these doctors and their colleagues providing oxygen machines to communities say they are prepared for a fourth wave and will do all they can to minimize the impact for those in need. Ntshepeng Motema, TRT World, Johannesburg.